Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome two very special guests, Mr. John Beleutz and Michelle DiBuduo, both executive directors for the California Caregiver Resource Centers. Welcome, John and Michelle.
Well, thank
It's
you.
a pleasure to be here.
Thank you. Well, it's an honor to have you both. John, I want to start with you. First, welcome for being here with us here at All Home Care Matters. You're the executive director of the Del Mar Caregiver Resource Center. And explain to us what the California Caregiver Resource Centers are.
The California Caregiver Resource Centers, which I may call the CRCs as we get going
CRCs.
here, to save us some words, are here to support family caregivers taking care of loved ones with cognitive impairments. It's a free service, totally funded by the state of California. That's really there to support the caregiver as our client, and that's what's really unique about it.
And Michelle, you're the executive director of the California Caregiver Resource Center, or the CRC. How many locations are there altogether?
There are 11 throughout California, so each one has its own agency. Valley, that's for an example, we cover 9 counties in the Central Valley. And so the other ones, so we cover the whole state of California.
Wow. Now, Michelle, how did you get involved with the California Caregiver Resource Center, or the CRC?
Well, it's kind of I'll give the abbreviated version. So back when I was not a senior and I was 41 years old, my mom had dementia, and we were in contact with the Caregiver Resource Center at that time. Honestly, we didn't use our services, except that we met with the executive director, who was able to just give us an insight on how to work with somebody with dementia. We were fortunate, as I've seen over the years, that we had 5 family members all working to help my mom. But now I see that that's not the norm.
Yeah.
And at that point, and taking care of my parents, I would go and do visits, with them at doctor's offices. And I would say, come back and talk to the executive director and say, you know what, I don't see the respect and dignity offered to seniors when they go to doctor's appointments. And she challenged me at that point. She said, well, go out and educate them. So that began my volunteer work with Valley. And then it evolved to becoming the executive director 11 years ago.
Wow. Wonderful. How about for you, John? This has kind of been a lifelong mission of yours. How did you get involved with the CRC?
Really comes down, to the mission here. I was really intrigued, and I've been with the Caregiver Resource Center for a while, since 2006. It was really intriguing because Health Project Center, the agency I work with, really works to keep people at home, not in facilities, keep them in a community setting. And the way we do that is we manage care for people and work with, people who have, needs. We work to train healthcare workforce, but what's really unique about the other leg in our stool here is that working with family caregivers, that's something that often is not done. It's seen as a add-on. You go to the doctor and they're there just to help with the patient. Right. Where we know the people we serve at the California Caregiver Resource Centers, they're spending on average over 40 hours a week providing care, which is, intensive caregiving. And when I really saw that, hey, this was a unique way to address a key component that really is often hidden, it got me excited and really, kind of brought me in this direction in my kind of public health career. And it's been a really fascinating and important way to approach these challenges.
Now, you both have been involved and committed to this mission, if you will, for a considerable amount of time. Have you seen positive changes throughout that time? Because there is a lot that is lacking for family caregivers? I mean, we see it all the time. Michelle, I really echo your sentiments of seniors sometimes don't seem to get treated with that respect that they deserve, and their families are almost an afterthought of what they're going through on the day to day, caring for them and maintaining their health and their independence. Have you seen positive changes since you guys have been involved in this?
On one hand, I can say one that's come up, and maybe John would confirm this, is that California has gone through developing a master plan on aging. And I think that that's drawing some attention to the role of caregivers. But the other side of it is I still think our message isn't getting out to enough people. I feel like we can always do more. I don't know if John goes through this, but what we always hear is, gosh, I wish we knew more about your services during the time that we needed them. And so getting the word out that there's help for them, there's assistance, that's still a struggle that I just don't see has dropped.
Yeah.
Change takes a long time. But I do think we've turned a corner where we're investing more money. At least in California, there's been the increased investment and focus on caregiving issues, as well as that focus is really about integrating caregiving into the whole care of the person and the patient and the family. And really, that is a change in thinking that's happened. But I think, as change happens, it's going to take years for that really to manifest itself in full change. But I'm hopeful, at least, and I think we are moving in the right direction. And certainly in California, with the master plan on aging, with increased investments in home and community-based services, including caregiving, I'm cautiously optimistic.
Yeah, and I would agree with that. We have found, especially during COVID, that a lot of families that were not aware of caregiving services, caregiving resources, had discovered them during COVID, whereas prior to COVID, they may not have been familiar with it. And I think a lot of that came back to, the restrictions on visits to loved ones in nursing homes, not being able to go into the doctor's appointments and things like that. And I think it helped to kind of raise the awareness across the board of what family caregivers are going through, what other resources are out there, rather than the traditional resources that everybody usually thinks of as a nursing home or, the hospital. And I agree, progress takes time and change takes time. And, the tremendous work that the CRCs are doing is hopefully helping to speed up that process. What would you classify, or how would you define what a caregiver is?
Well, what we think of a caregiver is basically someone who's taking care of someone who needs help taking care of themselves. Mm-hmm. That's really the most simple way to put it. They're not able to take care of themselves. We call them the daily living activities. And that's kind of what we measure it by. And there's so many times it's kind of convoluted what someone thinks is a caregiver and someone who isn't. And but basically someone who's taking care of someone who can't do it themselves.
You've been a parent, you've been a caregiver. If you're taking care of any loved one or your grandparent, you're a caregiver. And as kind of the old cliche goes, either you are a caregiver, you've been a caregiver, or you'll need one in the future. It's really something that affects everybody.
I think that was Rosalind Carter.
Right? Rosalind Carter, I still have.
Yes. What would you say are the biggest challenges you find that family caregivers are facing?
We work, in our work, we're seeing folks who are, as I mentioned, spending on average over 40 hours a week caring. So, there's really about taking care of themselves and making themselves the focus during part of their week, and not just their loved one. I really think that is the biggest challenge. And it's not easily corrected because they may be putting that 40 hours in with their family member and then turning around and going to work, right. Getting a 40-hour day there. And then finding that time among the rest of the time to take care of yourself is hard.
And that's not even taking into possibly still raising their children into that equation either. Yeah. Go ahead, Michelle.
Well, and I think too, and maybe John will agree with this, a lot of times the family caregiver is kind of like the Lone Ranger. They're the only one taking the role on as caregiver. They may have a family of 10 kids, and it's always, it seems like, one person that is taking on the leadership role or actually doing the hands-on care. So that's where I see that's a struggle for them. But again, with our services, we're really able to teach them how to ask for help, how to go outside of the normal realm, and kind of even there's so much to learn in being a caregiver. And so this is something that we try to teach them so that they don't feel so alone doing this job. But I see that as one of the biggest challenges.
Does the CRCs, do you guys offer like caregiver support groups as well?
Absolutely.
Yeah. And I think that's vital. And you just touched on it, Michelle. So many times with caregiver support groups that we facilitate, the common thread usually when they first come in for that first, session or that first group, no one understands what I'm going through. My friends don't get it, or my siblings don't even get it. And they come to that group and then they find all these other people who are experiencing and going through very similar situations as they are. And not that it makes it all better, but I think it gives them a sense of almost validation that, okay, I'm not alone. I'm not the only one going through this. And then they can build those bonds with those other family caregivers. I think there's, it's immeasurable the benefit that can have for a family caregiver.
Absolutely.
Yeah, we agreed. We run an annual conference. Well, sometimes more than annually, not recently, but for caregivers, and we get 100, 200, 250 caregivers together in a conference room with a day of classes, etc. And the biggest value of that we've heard from folks is not the information we're sharing or the courses we're teaching, which are important. Sure. It's being there and meeting other caregivers, seeing all sorts of folks, hearing advice from others who are living your life or or a version of it, and knowing that you're not alone. Something else that we also bring to the table for family caregivers is our family consultants. When you're a client of our program, you've got an expert who, what they do all day is they work with families, giving them advice on how to manage situations, like the fact that you're the only one caring, and to work with you and share what they've seen has worked with other families and share their experience to say, hey, you can't do this alone. Right. And then two, let's work together and create a plan together with you of how we can find a solution to that. And then I'm going to ask you about that next time we talk. And I'm here for you anytime you want it. And being that kind of coach and being that helper, that's really important because you can feel so alone. You can feel in a box, and you can often not see things that are out there because you're just one person. And we try to take the wisdom of of our experience in the crowds, and our family consultants take the wisdom of what they've learned from working with hundreds of families, and then really can share that with you to help you, because you've probably only gone through this once in your life and you're doing it now. We're there to help.
Exactly. And I think an important thing too is a lot of times families, I think, have a misperception that being a caregiver means you're taking care of a senior or an elderly person. And the demographic of the person you're caring for can be any age, and it could be any issue. And I think that's also a misconception a lot of times when you say, oh, I'm a caregiver for a family member, people automatically assume it's for an elderly parent. And I can't tell you how many families we've helped who have had, a child or a spouse who was in their 30s or 40s. And, caregiving has no description that is one size fits all. It can be anybody for any reason. But the one common thread is they all need that support, regardless of what their situation is. That's the one common bond. You're a caregiver.
And I'm going to add on to what John said too, and what you said also regarding support groups. Between the support groups and the family consultant, I really believe we give the caregiver hope. Because when they go to a support group, they kind of go in with a hopelessness, let's just say. And so then they're able to see other people on the same road that are thriving and doing what they're doing. And this is what we really try to promote, that they can have a life outside of caregiving while still being in that role. many times they go in there and they think they can't take a half hour to go get a cup of coffee because, all the cards will fall down if they leave their loved one. And they're listening to other people say, no, we did that. We were in your shoes, but now, we're able to do this. And now we're able to even give our family member better care, or, in that sense. And the same thing with the family consultant. It's giving them hope. They're saying, you don't have to do this alone. And from our experience, this is what the outcome could be. It could be different. Many times, I don't know, and I'm probably John has heard this too. They go into the support group thinking, again, they're the Lone Ranger in this situation. And one of the issues that we have to work with is all of a sudden they start saying, well, I don't have as bad as this person here, or, I don't, and they don't identify that they're the same boat. And that they need that same kind of care that they're wanting to give each other in a support group, so it's kind of a interesting dynamic.
So I asked why how you define a caregiver, because I don't know if you two have ever encountered this, but have you ever encountered the family member who won't acknowledge that they're a caregiver when they certainly are a caregiver for whatever reason? How do you address that when somebody says, well, no, I'm not a caregiver. I'm just helping mom with, her bathing and dressing and taking her to appointments.
Yeah, they think that that's just a normal family role.
Right.
And they don't identify as a caregiver, one, because they're not getting paid to do so.
Right.
And they feel like you're, what's the term, elevating their role by calling them, like a formal caregiver, let's say, which they're not. And so what you kind of do is you just kind of repeat back to them. So this is what you're doing. You're doing A, B, C, D. And who else is doing this? No one. And who else is responsible? No one. Oh, so I call you a caregiver.
Yeah.
And then they're shocked. So it's
Right.
kind of more or less kind of a role playing and reversing it back and having them hear all that they're doing.
Yeah. What we found often, when I found is when you're having that meeting, when you're sitting down the first time with a caregiver, they'll start telling you about the person they're caring about. And then when you stop them and say, no, that's important, but we're here actually to talk about you. You're the reason we're here now. We'll talk about your loved one later. That often is a time of tears when people kind of all of a sudden, whoa, and you're not saying you're a caregiver, but you're turning the tables and saying, no, we're here to help you. You're not here to help them. And that's why I'm not here to help you help them. I might be, but that's only part of it. I'm here to help you help you. And that's a paradigm shift for many folks. That can really
And it's almost a reality moment too, where all of a sudden it really, because I know, at least for us, we've seen so many families where, the denial of what mom's condition or dad's condition really was, they're going to get better or they don't want to accept it. And then at some point during that journey, the reality begins to set in. This is as good as mom or dad or whoever their loved one is going to be. And sometimes the loved one accepts it earlier and sooner than the family caregiver does. And that's often very difficult. It's very difficult. And there could be any number of reasons for that. Maybe regrets or trying to right some wrongs or, have some kind of closure. And it's very challenging. And you kind of touched on it, Michelle, but what would you say are some of the activities that you find the family caregivers are doing for their loved ones?
Well, you have the basic, activities of daily living, the bathing, the dressing, the eating, transferring, toileting, dealing with incontinence. But a lot of times it's also managing their health care. Mm-hmm. So you're going to the doctor's offices with them, managing their medicines. Pretty much you're running that whole side of their life. And those are the things that I think of. And then at the same time, you're dealing with their emotional issues. So a lot of times they step in a role of counselor without even realizing it, because the family member could be doing recipient could be in a grieving process with their own, issue of where their health lies. So I think those are the basic roles.
you want to add anything to that, John?
No, I think, it's a little bit of everything. It's really, and it's very individualized, because the folks you're helping have different capacities that will change and may improve a little bit or temporarily, but over time because we're specifically at the Caregiver Resource Centers in California dealing with cognitive impairments in generally dementias. And most generally, those are progressive for most of the families we're dealing with. They're not going to get better. It's about being there at the different points and adjusting. And that's one of the hard parts about it is that loved one is changing over time. And they're not becoming more cognitively, capable. And so what you're going to have to help them with next year is not the same as this year.
I just kind of want to add to something that you had said a little earlier. And that is, I think the family members don't plan. You asked about the challenges, and they don't really comprehend that it could go longer than 2 weeks. Right. So when you were mentioning they get a call, that from the hospital that they need to take them home, and all of a sudden they need 24/7 care. They kind of live in a short-term zone, thinking we just got to get past this section and it's all going to be fine. And I know from our experience, it's long-term. Yeah. And so getting the family members with their family consultant to think of the long-term care plan. Great, it might shorten, God willing, but for the most part, it's extensive. And getting families to really understand that what are you going to do for the long term?
Exactly.
Is one of our challenges.
It's one of those things where, the families, they don't know what they don't know. And most of them, they don't have a healthcare background. They're not planning or anticipating on having to care for mom and dad necessarily. You would agree with this. You were extremely fortunate. It sounded like, you and your siblings were all a unit, where that's not always the case, whether it's for geographical reasons or, personal reasons. All the siblings don't always align in, the same direction for what's best for mom or dad when the time comes. So you add that component into it. And then a lot of families are still raising children and working full time. And now they're becoming a full-time caregiver. What is it that they can do to stay healthy and to be in a good place as they're going on this, this journey that most of them aren't equipped or prepared for?
Big question. I'll give a couple ideas, but I'll leave the big stuff for Michelle here, but I think it's really about continuing to do the things you enjoy, continuing to have a plan for your own life, but also to be realistic in that caregiving is, if you're making that commitment, it's important to understand what you're committing to prepare for and be ready. Part of that is knowing that you've got to maintain your own long-term mental health and physical health, and your life is just as important as the person you're caring for. So you really got to find that right balance, which nobody can find for you.
Right.
The only thing I would add to that is breaking it down exactly for what John said, is making sure, which is something they don't do, keeping their own medical appointments, thinking they're as valuable to go to their heart doctor, the cardiologist, or the whatever doctors they're going to, because many times what we'll see is they'll skip their own appointments in order to take care of their family member, because the family member's needs they think are so much more important than their own. And so that's something we really try to promote. But you have to break it down, because when you just tell them take care of yourselves, like they don't get it. So, and like John had mentioned, the family consultants will keep them accountable. Did you go to the doctor? Did you take care of yourself? Because I can't tell you how many family members' health I'll use what is the percentage? It's like 67% have a higher mortality rate than someone who's not a caregiver. Yeah. And that's because they're not taking care of themselves. And the other thing they really need to do right away is to develop a support system in order, because like you had said earlier, many of them don't have siblings or family members to help them out. So they need to go outside their realm, look outside the boxes to develop their own support system in doing so. And then, and with what we teach in our classes, because we have a variety of classes, powerful tools for caregivers, the language of dementia, different things to give them the tools, that they have to learn simple things like going in the bathroom and meditating for 10 minutes because they think they can't get away, but just to calm themselves down, just taking those little bits of time to, revive themselves so they can continue doing the work they're doing.
Right. And I know we've experienced where family caregivers, like you said, they will neglect their own healthcare appointments. They'll even forego refilling a prescription because they feel like they can't leave their loved one. And I think a lot of it also is guilt. They feel like, well, I shouldn't leave them. I'm going to feel guilty if I go to my appointment and leave them here for that hour or two while I'm gone. And, there may be some cases where it's not safe to do so, but that's where, going back to what you said, you have to have that support system around you. You got to have that person you can call and depend on because, and I'm sure you guys have used this saying, if something happens to you, what happens to your loved one, And again, I think it's also the problem of it will never happen to me, I'll be fine. But like you said, statistically, family caregivers do have a higher mortality rate. We have even seen with family members where they have preceded their loved one in passing because their health got so bad, their loved one who isn't aware of it because of the dementia, they're going day to day and, these outside external factors aren't affecting them in a negative way like it is their loved one or, their family member who's caring for them. And, it's just practicing and preaching that self-care has to be your first priority because if something happens to you, you're the only family caregiver. What are you going to do with your loved one? And I think that's such a crucial, vital part of being a family caregiver, not feeling a sense of guilt, where it's okay to take care of yourself too, and I think that's a very hard hill to climb because a lot of them, feel like I'm okay. I don't need it. It's not going to happen to me. I'm just going to continue, and once like that 2-week idea, it's only going to be for a little bit of time. Then I'll get back on track with my stuff. And oftentimes that's not the case. It's long-term.
And they also think it's their responsibility and they shouldn't be pushing this burden onto other people. This is their role. And it's unfair. I really wasn't going to bring this up, but I have to because it goes with what we're talking about. Recently, my 35-year-old son-in-law had a brain bleed. And so my daughter is taking care of him. And we're constantly, it's not at odds, that's bad, but telling her, okay, we need to come in because it's 24/7 care. He has no short-term memory. And she thinks I'll say, okay, I'm spending, 3 nights this week. And so you can, because she's also trying to work while we're taking care of him. And her mentality is, it's not your job. And it's like, yes, it is. And so I'm living it again at whole. When you mentioned earlier, people don't think this age group has these issues. And so it is so important to get people to realize that everyone can care for someone. And it's not just their role because they're either married to them or it's their parent. As a society, we can all pitch in and help.
Right. Absolutely. Well, let me ask you guys this. Go ahead, John.
No, I was just to say that would be the sign of a healthy society, that we have ways to care and help each other without feeling burdened.
Yeah, guilty.
Yeah. And so what does the CRCs do if they find that a caregiver needs help providing the care?
Well, we offer many resources. One is that we are able to provide respite, which is giving, the caregiver intermittent break. Now, granted, it may take a lot of convincing for some people to allow, someone from an in-home care agency, but once they experience it, once they taste it, like this break, they love it. And they just, I wish we could give more and more, but we all have our restrictions on how much we can fund. The least we give them a break, even if it sounds so small to some people, but even, 2 or 4 hours a week to give someone a break to go to keep their own doctor's appointments or go get a cup of coffee or take a class. It's so valuable. So that's one way that we're able to do it.
Something else, which is hard, but I think really important in working with families, is that there is also beauty in caregiving. There's also wonderful things that come out of it. And while those may not happen frequently enough for everybody, to help people to see those things, to help them to celebrate them, and to try to enjoy where you can the love and the good things you're doing there. And I think being with other caregivers can sometimes help you reflect on that, because it's easier to see somebody else doing something heroic than yourself. But maybe then you can begin to see yourself in them. And there's no easy answers there, but I do think that there's beauty in caregiving. I don't know, not being very articulate here, but looking for ways to pull that out and help people to see it can make a real difference.
Well, I would agree with that. I feel like caregiving is noble, but it's also very beautiful in the sense that, you're bonding with a person in a way unlike any other healthcare professionals can. The doctor's not going to spend that one-on-one time with you, the nurses, even the staff in a hospital or a facility. I can't tell you how often, we've been a part of family weddings, family births, family funerals, all these special milestones, but we're there as the caregiver for that person. And had it not been a caregiver with them, we wouldn't have gotten to experience that. And I think that's all part of the healing process and the caregiving process. It's not just doing tasks or the ADLs. I mean, that's important and that's necessary, but the other component to it is, and I think this is why a lot of times families choose home care over a facility, that person still, as much as they're able, has full control over their life. If they want to eat lunch at 4 p.m, they can. If they want, meatballs and spaghetti for breakfast, they can, as long as it's not contraindicated, of course. But, they still can feel that sense of pride and that independence in being in their own living environment, whether it's with a family caregiver or a little bit of both, or professional caregiving. They still feel like they're in their home and they're kind of in control of their life as much as they're able to be. Once you take that away, I think a part of that person kind of dies on the inside, because this is it, so to speak. But then, that caregiver, whether it's most, family or professional, they're getting to make these memories with that person that only the two of them are going to ever share. It's not going to be shared with another person, and I think that one-on-one personalized touch really speaks volumes to whether it's family caregiving or professional caregiving. And I also think it's better for our healthcare system as a whole as well.
Almost nobody wants to be in a facility. Families don't want to go there. There's a place for it. There's
Sure.
a time and a place, and every family's different and every condition's different. But, that isn't where most folks choose to go. It's and it isn't a place that most folks can afford to go, to be honest, because Medicare isn't going to pay for that. You're on your own. That's out of pocket. You're paying $110,000 a year if you're in California to put someone in a facility. So that isn't, and 85% of long-term care is provided by family members in this country. That is our long-term care system in the United States. And it isn't changing. We're not building facilities. We're not, that isn't the answer to going forward. The answer going forward is programs that support people at home, like, supporting family caregivers, like, providing in-home care so that families can get a break, like sending in the medical, providers into the home. It's
Right.
more affordable, it's more humane. And the reality is, it's what we're doing now in sometimes a piecemeal fashion, unfortunately.
Well, and I think you also will see better outcomes too, as a whole. When the person's in their own home and getting the doctor visits, the physical therapist, the nurse, the caregiver, I think their outcome is better than if they were receiving that same care in a facility. And that's been statistically proven. And just to touch on what you said, 85% of long-term care is provided by family, and they make up the backbone of our long-term care system. Yet, they don't receive much recognition or support. How does that change?
It's tough. I mean, it's one family at a time.
Right.
It is looking for opportunities to give them resources and support, and help. It is ways to recognize them and say, no, what you're doing is important, and that is societal change, because we don't we don't value the stay-at-home mom who's a caregiver. That's what they are. They're caregivers for their kids. We don't we can go down the list, but we don't pay, look at how we pay our home care workers. They're going to get a quarter or a fifth or a sixth of what your plumber gets. And that's, to my mind, until that changes as a society, we're not really there yet, because the complexity of what someone caring for a loved one with, not a loved one, caring, if you're getting paid to go out and care for somebody who's got dementia, the skills required for that should be there are a lot. There's a lot that's going on there. And as a society, we have to recognize that we have capitalism. People get paid based on their value, and we just are not valuing that group of folks in any way near what we need to be. And that's why there's a shortage of in-home care providers. That's why people don't feel respected. They're not getting benefits necessarily, or they're certainly not getting respect, and they're certainly not getting paid well. And I'd really love to see that change, but it costs money.
Absolutely.
And on a social level too, family caregivers are very isolated, and breaking through that isolation is a big job. And so I'm always encouraging people to share their experiences, share them with their family and friends. And when even sharing our services, that's a big thing. Word of mouth, I think, it helps them feel valued also by acknowledging what they're doing. But I think the biggest thing is getting family members to not be so isolated, and to break out of that role of that. I don't know how to say it better, but I don't know how to say that better, to be honest. They just need to be able to communicate with other people. They need to do their support groups. They need to do their education classes, or just have a friend, a coworker or somebody that they can talk to and share what they're going through.
Well, and Michelle, I'm going to piggyback on that and say they're already going through a tremendous ordeal to begin with. They're most likely learning new skills that they never knew how to do before or had any familiarity with. And when you add in a component of family conflict into that, on top of caring for mom, trying to manage your job, keep up with your health, it just snowballs, right? What does the CRCs do, or how do you handle or approach if you get involved when you have a family you're supporting, you have the one primary family caregiver, and then she's coming or he's coming to the center saying, my brother and sister, they're just making this as difficult on me as possible. They undo everything I've done, whatever the conflict may be. How do you approach that or address that through the CRC, or do you?
We do. I love this part of the work we do, is that we have family consultation meetings.
Okay.
We'll gather people around, and we'll kind of talking mainly to the identified family caregiver too, to kind of see what some of the goals in the family might be, or what some of the issues are too. We try to stay positive. And then we just try to put those out there in a meeting, in a conference. And sometimes we do them in person. We had to do some virtually, through COVID, and it still worked. We had a family member that was back in New York, one, I think in Texas, and two here. And it was great hearing what they all brought to the table. And whereas the identified family caregiver didn't have they didn't have the support, it ended up coming out in other ways. Okay. So I think family meetings are very valuable, and having a unbiased person leading the meetings is what makes it work.
Right. Okay.
Yeah. Families bring to the table all the dynamics that they've always had, all the challenges, all the disagreements that they've had over the last 80, how many ever years you have. And people think, well, if there's a crisis, we'll all come together. Well, sometimes a crisis can accentuate the differences and challenges, because it's a difficult situation. And recognizing that, but then moving forward and trying to solve those is really what's key. So that's why it can be hard, because you're bringing forward lifetimes of challenges and disagreements, and maybe the person being cared for was not an angel, and so people will come bringing mixed feelings about dad or mom. or whatever. And those get thrown into the hopper as well, and they don't go away.
We had one family once, and this is the only time this has happened in many years, but their health insurance had actually called a special meeting to discuss their long-term care. This person was in their early 40s and they had a debilitating muscle disease, and the option was either going into a facility or having home care. The health insurance actually made an exception and paid for her to have home care in the home. So when our case managers were talking to them, we'd never encountered this, never heard of this, because you only have limited resources to pay for home care. And they said their panel decided it would be more cost effective than putting her in a facility. So our question to them was, wouldn't that be the case for everybody? Still waiting on the answer for that one. But have you ever encountered that situation before?
I haven't.
I have not. That sounds like a good insurance company, though. At least they're trying to do the right thing.
But I just gave them kudos because, this person could have stayed in their home and her insurance made a good, sound, fair decision that allowed them to, and, so that meant she could stay with her husband and family. But I just thought it was interesting. They thought it was more cost effective than a facility. But I mean, the argument could be made that you could say that across the board.
Yeah. One of the challenges is that the facilities often are not, the insurance company often isn't on the hook for long-term care in a facility. That's not usually part of the insurance package. So they don't have to bear that cost. In this case, they were talking about they probably have long-term care insurance. And then it would seem to me, but it could have been their actual condition that they had was such that if they, that made that happen in an unusual circumstance.
Yeah. But I just, because when we were talking about progress and things, I always think about that situation thinking, at least the thought process is starting to go in that direction because it is such a more cost-effective way. And I feel like in a lot of ways, it's a better quality of care too, for the reasons we've already talked about, that one-on-one attention, the support that the families would get, much like the tremendous work that you guys are doing at the CRCs. It's remarkable. I don't know, but I'm not familiar with other states that have anything like this model. Are you familiar with any other states?
I know the Family Caregiver Support Program is throughout the United States, but I don't know any models that are like ours.
Yeah.
Through your local area agency on aging, you can access local services that are like ours, and we work with the local area agencies. But we are a unique kind of model that, and I don't know a lot about nationwide, but I do know, that we've been working on this model since the 1980s and have reached results. Really with our kind of comprehensive set of programming, I think that's what's key, is that we're able to come in with that family consultant who can help you. We come in, if you need access to a legal advice, we will hook you up with an attorney, elder law attorney to talk about estate planning. We'll provide you with a grant so you can get respite care or counseling. We'll therapeutic counseling we can hook you up with and help pay for that if you don't have it available to you. We really started with we sit down with them and come up with an action plan, and we'll spend a couple hours asking questions, talking about, come up with a joint plan that we want to execute with you and your family. And then with these resources around it, we're able to make it happen, and so it is an exciting model. And, our challenge now is getting more people to buy into it, and getting more, because as you already mentioned, getting folks to accept that they need the help sometimes is one of the biggest barriers.
Right. Well, I think it's tremendous the work the both of you are doing in the CRCs, and I applaud you because, this is a deep passion of ours, is supporting family caregivers and caregivers in general to get the support they need, the resources they need, and ultimately the recognition that they deserve. And I just really appreciate your time today. We are excited to share a video that you provided us here at the conclusion of the interview. I've watched it a couple of times, and it opens with the Rosalind Carter quote, remarkable quote. And I hope to talk to you guys again in the future.
Thank you so much.
Thank
for
you.
your good work.
Thank you, Michelle. Thank you, John. You guys have a good afternoon, and we'll look forward to speaking to you again.
Many Californians provide help to a loved one living with Alzheimer's, dementia, or a chronic debilitating condition. This experience changes the lives of friend or family caregivers forever, with devastating effects on those providing this long-term care. Being a caregiver can be overwhelming, but you are not alone. We are here to help. Founded in 1984, the California Caregiver Resource Centers are a network of 11 nonprofit centers throughout the state offering free and low-cost support to unpaid friend or family caregivers. Together, we serve every county in California, providing a range of services from counseling and care planning to legal and financial consulting and even respite care to give you the caregiver resources you need. The CRCs are united by shared values emphasizing choice, collaboration, innovation, quality, participation, respect, diversity, and inclusion. There is support wherever you are. You do not have to go on this caregiver journey alone. Visit our website, caregivercalifornia.org, to connect with your local Caregiver Resource Center today.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And please remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. We'd also like to thank John Beleutz and Michelle DiBuduo again for joining us today to discuss the many resources available through the California Caregiver Resource Centers. Thank you so much, and we look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.